Three things. First, essential plan. In your testimony, you said that and I'll actually read the quote. The budget will eliminate monthly premiums for over 400,000 New Yorkers, which that's a good thing. So how do you plan to cover that elimination of premiums, by the way?
Donna,
Yeah, the federal rules around the benefit trust fund, where the state receives 95% of the tax credits, allows for two things: services and reduction in consumer costs. This is a reduction in consumer costs.
Gotcha.
We will
trust fund.
increase.
So it's the trust fund. How big is it right now? How big is it? Right
The balance of the trust fund that we expect at the end of this fiscal year is $4.5 billion.
4.5 billion.
Yeah.
It's a question, because I want to make sure that we move through these. So I believe, by the way, that that's a good thing. However, why are you only eliminating medical premiums and not the $30 vision and dental premium for patients? Is there a particular reason why you chose not to do that one?
Well, I think what we saw was that during the COVID was that the $20 premium for the medical care was causing some people not to be able to continue it or not want to continue it. And we also, in addition to this premium helping existing consumers, the 400,000, we also believe it drives about 100,000 new enrollees.
I would certainly hope that we use that money more expansively and extensively, because it's there and we should certainly use it. But I want to move on to safety nets and actually Liz Kruger. If Liz Kruger was a basketball player, like basically she would be like, that was the biggest of slam dunks. It's like she flew over a car, because it's like it was absolutely on point. Now, the governor has been consistent in the message, at least, that they're important to safety net hospitals. You folks certainly did that here. But if the administration is so committed to safety net hospitals, then how do you rationalize the proposed cuts to the ICP for public hospitals?
I think that for the 4 or so hospitals that would be affected, the state funding would not be available, but under the DISH caps, the funding could still be received with local dollars if there was an IDT
counties. So basically, you're putting the onus on counties.
It's the state share savings, yes. And those, as I understand it, I'm sorry.
Go ahead. I'm going to let you finish that one. Go ahead.
I'm just getting a little feedback. I'm sorry, Senator. So go ahead. I think I've answered the question.
Because the thing is that I'm concerned about you putting this on counties, because given the ongoing fiscal strains in counties, I mean, should it be on the counties to make up the difference to protect these hospitals? I'm concerned about that. So instead of cutting safety nets that have been essential, and they're called essential for a reason, right? Why don't we protect them? I mean, this is actually something that I'd like to ask both of you, but particularly the commissioner. So do you believe that we should be raising revenue to be able to avoid deep cuts to safety net hospitals that have been so essential during this? Well, don't tell me that the feedback comes now when I ask about revenue.
Senator Gallivan, go on mute.
Commissioner?
Are you still there, Commissioner?
Yeah, but the question I lost because of the feedback.
Yeah, I figured. I'm going to need those 15 seconds back. The question is, would you, to avoid deep cuts to safety nets that you say that you want to protect so much, would you say that we need to raise revenues?
That would be one. That would be one option, I guess we could tackle. I'm trying to figure out how.
If you were a legislator, I would sign you on to the entire package of Invest in Our New York. But this is the last point I want to make, because I'd only get 5 minutes. But and I have a couple of other colleagues that were getting me questions. I just couldn't get to them. But listen, as far as the global cap, I just want to underline this. I mean, the purpose of it, which it's arbitrary, and we all recognize that, is to regulate spending in Medicaid. In the last fiscal year, the program faced $2.2 billion in cuts. And this budget proposal today cuts well beyond what is deemed necessary for the global cap measure. I mean, you told us yourself that you had savings here. So if public health is the priority, as you stated, Commissioner, and Donna as well, and given that 5.4 is made available through the enhanced FMAP, a portion of which is also and as I said, it's just bananas to me that it's being used for general fund relief. Why should Medicaid providers take a deeper cut so this administration can use Medicaid funds for whatever purpose they see fit. And I'm going to leave that question hanging because that's going to be an underlying thing in this whole conversation about the budget, which is still kind of crazy to me. Madam Chair, that's my time in the second round.